Hi,
Hi,
how are you?
I'm good, thank you. Yourself?
I'm good, thank you so much. We have Noor. Sorry if I'm not pronouncing it correct, but yeah, she's a registered dietitian in Canada, and she has a really interesting background. In a sense that she has been practicing in two different provinces across Canada, so that's why I asked her, and she was so kind to accept my request to share her experience with us today. So please, Noor, go ahead and introduce yourself just in with more detail, and tell us where you are now in your career.
Sure. Yeah, thank you for having me today. So, I have been a dietitian for 10 years now, actually. It's pretty exciting. Um, I did my high school overseas, and then I moved to Alberta, where I did my undergrad in nutrition, 4 years plus a year of internship. Then I did also a master's in nutrition. And then I worked in different fields. Like I started with food service management. I did some clinical on the side, and then uh, when I moved to Quebec, I also started in food service, and then was doing some clinical also at like clinic, and then I finally decided to switch just to clinical and worked with the geriatric population to start, like at the long term care, and then switched to pediatric, where I've been working now for like 3 years. In addition, I have like my private practice, and which is relatively new, and then like an online store that I can share more about as well.
Yes, sure. So, and this is the Instagram page for your online store, right?
Yeah, yeah,
To join
that's right.
us. Okay, we'll talk more about it later. But I just wanted to know, did you do your dietetics or in Alberta, right?
Exactly.
University of Alberta.
Yeah.
Can you go a bit more in more detail?
Um, so it was 4 years of like undergraduate courses and a year of internship. I did my year of internship right at the end, so it was like a full year after I finished my course load, and it was in many different places. Like it was divided into like community nutrition, which is almost like public health, food service management, and clinical. Clinical was beginner and advanced. So it's a little bit different than here. Here I know they have levels, but again, it was 10 years ago. So I'm not sure how different this is now. Uh,
Yeah.
yeah, so I would say clinical was the most part. Like I think, if I remember correctly, it was 3 months of community nutrition, 3 months of food service, and then about approximately 5 months of clinical. So it's not exactly a year; it's almost a year. Kind of.
Okay, good. And did you clear any exams after graduation from bachelor's?
Great question. Yes. So in the Anglophone provinces, so all provinces basically except Quebec, you do have to do like a national exams. So I did the national exam. It was like a 6 hour
Oh,
exam. I did it in Alberta. But then when I moved to Quebec, it was different. I didn't need that exam, but I needed the French exam
mm.
in Quebec. Um, so, like, you can get a temporary license without the French exam, but at that point, I didn't want to go through that. So I decided to just study French, and then I did the exam when I was ready. Because I was on a maternity leave, so I had the time luxury to just to study French, take my time, and then when I was ready, I did the exam, and that's when I was ready to start looking for work in
Oh,
Quebec.
wow. So you started from zero regarding the French exam, right? And then you learned everything.
My French was very basic before coming to Quebec. Like, just out of interest, I had done a little bit of beginner French before coming here. but I did my hard work learning French in Quebec.
Oh, wow.
Yeah.
Impressive.
Uh,
Great. Okay. And then the next question that I had was that why did you start from food services
that's a great question. So it happened that the last part of my internship was food service
in
in
Alberta?
Alberta. So it just was natural that they just hired me because I was graduating, and I was very fortunate because they were an amazing team, and I was learning so much. It was so dynamic, and we're always like problem solving. It's not exactly what you think of dietetics, but it was an awesome experience. I feel like on a personality level, growth level, maturity, all of this, it made me grow so much. Absolutely loved it.
Can you explain a bit more about the food service management, the whole, situation? Just take us through it.
Mm-hmm. I'm gonna tell you a little bit about how it was in Alberta and then how it is in Quebec because they're not exactly the same but similar. Um, so I was basically a food service supervisor, meaning I had to make sure that staff were available for their shift. If there were sick staff, I had to look for replacements, and usually because I did this at a food service center in Alberta and a hospital in Quebec. So the shifts were early morning, like around 5 in the morning was the start time. There were other shifts that were evening shifts, but I'm gonna focus more on the morning because it was the most where more work is required from my experience. So yeah, you have to make sure staff are on time. If you get sick calls in the morning, you have to look for people, use your communication skills to convince people at like 5 in the morning to come to work
Wow.
when they had other plans. But they noted that they were available using like a specific system we have. And then the best days were when we had no sick calls. It's like every other problem. My, hopefully, like there are hard problems, but after that, you'll see like sometimes you have surprises like shortages of specific foods, and that's where you use your nutritional knowledge, right? So you have to find the best alternatives. Actually, even in Alberta, I worked at the hospital. I just my first thought of the food service center because that's where I did my internship, which was affiliated to the hospital I ended up working with. So my memory was kind of fused with the two. But either way, so let's say I come and we have a shortage of something. I have to see the patients that are needing this food and find the best alternative. Now in Alberta, we had a great system that was very helpful. So yes, my nutritional knowledge was important, but the system would help me so much. In Quebec, it was harder. Like I really had to use more of my nutritional knowledge uh, when I was doing patient food service supervision. What else do we do? Problem solving all day. Like something will break. Like let's say, because we used trays that were like half hot, half cold, and let's say the machine broke. That I would have to come up with a plan on the spot that solves the problem. Um, Trying to think. There was always something new to learn. Like when a fridge broke, I had to think, it was the lock. I had to think of how to access those foods because those patients need it or will be in trouble. So I had to think manually how to just quickly disintegrate it, get what I need, and then we'll get somebody to fix it after, but at least have access to the foods. Um, Sometimes I had to do patient visits, even in as a food service supervisor. In Alberta, it was more with patients who have very many restrictions because the clinical dietitian on the floor would put in the restrictions in the system, but then let's say you put in so many restrictions, the system will find nothing for you to eat at the end. So those would come to me like they'll be like, oh, there was no main meal for this person, so I would have to I guess I could talk with a dietitian, but when some of these restrictions were not clinical, they were more like preferences. I would go and just make sure the patient is aware, and those are all valid restrictions, because many times they would say, okay, this I'm fine with, this I'm fine with. Again, it's the non-clinical ones, because my role was not the non-clinical, like it was the food service management. In Quebec, I would visit patients who had complaints. That I did more. It could be also where I was working. It doesn't necessarily have to be Quebec and Alberta. It could be just a difference between different places. Yeah, has been a while. This was my first my first job as a dietitian.
So you were not you were a registered dietitian when
I was, yeah, a recent graduate. Like it was right when I graduated, before even having all my papers. Like I had the authorization from the College of Dietitians in Alberta, but yeah, it was very
no.
early.
Oh, interesting. Okay.
Yeah. I also did cafeteria management at the hospital, and because it's a hospital, it's interesting. It's not like because you
Outside.
have more limitations. Yeah, because some foods you use for the patients and for the use them in the cafeteria. In the cafeteria, you have more liberty of like adding spices, salt, etc. But still, like the basics are the same. And that role was more like a creative role, because sometimes I would buy new stuff for the cafeteria. I would look at how people buy things, and I'll be like, oh, like they're having difficulty seeing items. I would reorder items so they can see better,
Ooh.
or they would have a problem reaching. Efficiency is big also, because you want. Obviously to save time and money, but you also need to keep in mind the movement, staff movement, because you don't want them to injure themselves. So you have to find the best position for things around them to minimize unnecessary movements, basically. So it made me practice looking into efficiency and improving things, which started in my internship, actually. A project was building a new, we called it a cell, and I had to figure out the best places to put things so they require less movement and they're finished in faster time. It helps in everyday life too. Like now at my home,
Exactly.
first in, first out. I order things.
Exactly.
That's
That's what I'm going to say.
also
It was like more of a management aspect of nutrition.
exactly. Yeah.
I see what you mean. And can you tell us a bit more about the exam? Like, how was it? You said it was a 6 hour exam, but what did you study? Did you have any like special books to study, or I don't know? I have no idea about the exam.
When I did an exam, the general understanding was that there was nothing specific to study. Because after going through the internship, because it was right at the end of the internship, it's like a summary of everything you learn. So technically, you should be prepared. But of course, to feel better, I went through my like the main textbook, like advanced clinical nutrition textbook, food service management textbook. I think those are the ones I went through just to feel better, like basic calculations, just in case there were stuff I didn't study like I didn't come across in the internship. It wasn't hard, but many questions were analytical. So at the end of the exam, it's hard to be 100% sure that I got it right. Then they just tell you if you passed or didn't. They don't give you a score, so you don't even know
Which
if
one
you
was
got so many right or not. But yeah, you know that you passed.
Yeah. Did you have any practical tests, or it was just an exam?
No, because in the internship, after the end of every section, which was for me, most rotations were about 3 weeks long. Some were longer. So after the end of every rotation, which is like being in one place, the supervisor would write an evaluation. So it's almost like an exam, evaluation of all the important skills to learn, and then they would put them all together at the university to make sure it makes sense that you covered everything you need to cover.
Interesting. And if it's not personal, I would like to ask about your master's. What was your motivation to do your master's when you were also, already a dietitian, having your degree, graduated, having your job? So,
Yeah, that is a great question. So, I'm not sure about Iran, but in the Middle East, we have this belief that,
yeah.
you just want, yeah, exactly. You have to go on more and more and more. So it was just set in my mind that if I can go more further in my studies, I will go further in my studies.
Okay.
So I was finishing my undergrad before doing the internship, thinking that I wanted to do a master's. And I remember I talked to the supervisor that supervised my undergrad project, and like planned to do a master's with her. And then uh, at that time, I was applying to the master's and applying to the internship because it was a separate application.
Ooh.
And then when I got into both, it was a hard decision. But I decided to do the internship and defer the master's.
Okay.
So when I finished my internship, that's when I was in the situation you just mentioned. That I'm now a registered dietitian. I'm eager to work, but I have committed myself to a master's. What should I do? So I went and talked to the supervisor, and we found a plan that I was able to work and do my master's
Wow.
at the same time. But I was working part time. Like I was working a lot of weekend shifts, and sometimes, let's say I had to work on a weekday, then I would make up the time and work more on the weekend. Made me very busy. Like I was busy 7 days a week, basically. But
24/7.
masters was also very enriching. I think like now I'm so happy I have very strong analytical skills, and I think the masters has a big role in it. You always have to think deeper. You can't make random assumptions. You have to really analyze the situation. Like in that case, it was research. So
For
just
sure. Exactly.
yeah, things make sense. Your sentences make sense. Like even for communication, it's
Exactly.
important.
Exactly. It affects you.
Yeah.
Interesting. And if you want to talk about different job prospects of nutrition, studying nutrition in Canada, what would you say?
So there are so many different jobs for dietitians in Canada. Um, the ones I know most about are like, yeah, food service management, the clinical dietitian, whether at the hospital or a public health center, or in Quebec what we call CLSC, where you get public consultations dietitian. You can do a community, which is like education, for example, making resources. There are also many other opportunities that I don't have experience with. For example, you can work with a pharmaceutical company.
Oh.
Yeah, you can work with the companies that make nutritional products, like Abbott, for example, or Nestle. You can you can do research that I actually have experience with, but not as a dietitian, more as a student. I was also a research assistant, and I did a marker for like nutritional course. What else can you do? You can analyze recipes for like some companies also, like there's a nutrition fact label. You can review menus and make recommendations. Private practice also, you can obviously like do whatever you're ready to do, whether it's consultations or like education or both. Yeah, there are so many different things, and the great thing about nutrition is that you use it every single day
Oh, yeah.
at
Even for you.
home, everywhere. Your knowledge is very valuable wherever you go.
Exactly. Exactly. That's true. I was thinking about talking more about your experience in Alberta, but then at the same time I was thinking, okay, is the college of dietitian in Alberta different from Toronto, Ontario?
It is.
Do
So,
they have different rules?
mhm. So every every province has its own college of dietitians.
Mm-hmm.
I actually have registered in Toronto, in the Ontario one, for a very short time because there was a possibility of me moving.
Mm-hmm.
And for me, it was very easy because I was registered in Alberta because I had the national exam done. But I've heard from people who just graduated from Quebec and didn't have the exam that they had to go through more steps to get registered in Ontario. So they have also, when you're registered in the College of Dietitians, you have requirements regularly. Like, for example, you have to do continuing education. Now, every province has different rules. So for Quebec, for example, they review them for every 3 years, the total of the continuing education courses. In Alberta, it was yearly, but you had to write like a summary, like a paragraph about what you did in general. In Ontario, I didn't continue a year because my plan changed, but from what I read at the time, they were more on. It might have been ethics, I think, that you have to do regularly. Like in Alberta, it was maybe every 5 years, but I think in Ontario it was more frequently. Whereas here it was different. We didn't have to do that. It was more just the continuing education. And here they had also different categories when I started. Like you have to do the clinical ones or like the knowledge based, and then the more like the political ones or the ethical based ones. But then they changed this. Now it's not like that anymore.
So
Yeah.
I know that students from McGill. I don't know how, but can you talk a bit more about the like you've seen Iranians. What are the gaps in our knowledge? I don't know, experience in anything. What have you seen? Like, what is your experience?
Uh, because every student is different, I think I would need to see more Iranian students to be able to see like if there are common areas of improvement, common strengths. What I saw was that one strength was calculating like the macronutrients
Mm,
food. I felt that was a strength compared to other students I had. Um, Other like areas for improvement, for example, I saw the reality here is a bit different. For example, how you take the medical history,
mhm.
what kind of things you need to review. Those from what I saw were different. But again, I have to see more students because I also had non-Iranian students and they are different.
Different.
Language can be a difficult area. Like I remember for myself when I was an intern, even though my English was good, things that you use on a daily basis in like work area are not the same as things you use from like when you're reading a book. So it was difficult for me, and I saw the same thing with not just Iranian students, all the international students. Sometimes they would be difficulties in
Mm,
understanding specific situations or certain foods, which I think is a normal thing that will just have to come with time. Like as long as there's interest in learning and there is hard work, you make notes of these things, you go to the supermarket, do a good research on those foods that you've never heard of, then after that it should be an easier job. Like now, sometimes I would still have hear of new foods that some clients would tell me from different cultures. Obviously, year after year, this like it becomes easier and easier and easier. But we will always learn. We will always learn more.
exactly. Yeah. So I'm thinking about non-PR students maybe. Is it easy for those who are international students to become a dietitian here? Because I haven't found like so many either from my nationality, or it doesn't matter, the nationality doesn't matter, not like international students. I couldn't find so many international students being a dietitian here and practicing. Is there any laws for that, or I don't know?
That's a great question. I don't know.
Okay.
It's,
have you have you seen internationals? Like,
One of my students, I remember she was an international student, but I didn't ask her about more because she was looking for work when she finished.
oh, okay.
But I didn't ask her like how she was able to maybe she was able to switch her status. I'm not sure.
Okay, no problem. And what about the French? Is it a huge like hurdle for students or here in Quebec?
Yeah. So you would need to learn French, I would say, in almost all jobs here, like as a dietitian. I'm gonna say almost because, of course, there will be always the exceptions. Um, where I worked, they were places that serve a lot of Anglophones. So I always use English more than French because of the nature of the place I work at. But I was only hired because I have both languages. Like, they wouldn't have hired me if I wasn't able.
French to do.
Yeah, because when I have a French client, I'm gonna switch to French. But at the same time, my French level wasn't good enough, in my opinion, for places that were basically more French places. Like, for example, the hospital I worked at when I started here was affiliated with McGill, so it was, yeah, there was a huge portion of my work was in English. The center I work now is allowed to work with like the Anglophone community, so it's a good percentage that I do in English, but at the same time, I'm 100% ready when I have a Francophone client to help them. Yeah, it is very important. I think I was lucky that when I came here, like I had the time with my maternity leave to work on my French without the stress of not working for some time. It was fun too. It's good to just take a break from home responsibilities and
Of course.
practice something new and see people. So that helped me. Yeah, definitely important.
I see what you mean. Do you want to talk about your online shop?
Yeah, for sure. So the idea came from my most recent type of work, which is working with children. I came across a lot of picky eaters, and many of them will have preference to a specific texture and or some specific color or specific flavor. So the way we work with them is that we want to gradually move them from what they like to get them to learning about what they don't like. And the way you do it is that you don't just introduce new food that's completely new. It's a high chance that they're going to refuse it. One of the ways is that you ask what texture do they like? Do they like crunchy foods, for example? And then what food group am I looking for? Like, are they the ones that tend to hate protein, for example, which is a very common one? Or fruits and vegetables, or am I looking for my specific micronutrients, like iron, for example, a big one in certain picky eaters, many actually picky eaters. So I would be in the session and trying to think, okay, let's see, this kid doesn't eat meat, and we're not ready to introduce it. You can't just go and say, oh, your iron is low, just eat more meat. This is a picky eater. The iron is low is because they hate meat. I would have to think practically. So I would be like, okay, maybe lentils, but they like crunchy. So an idea would be crunchy lentil snacks, for example.
Ooh.
Yeah. Maybe they hate fruit, but they also like crunchy. So I think, okay, freeze-fried fruit. That can be an option. There were many things like this. So I was like, okay, if there was just a way to help me decide based on the fruit products that are available. And it actually came from a parent who told me, why is it so hard to find these things? And I thought, yeah, why is it so hard to find these things? So it started there. So I start to look for products and then to sort them. So you'll see like sorting by food group, like vegetables and fruit, protein foods, or grains. And then in each category, you would see filters like, for example, this is crunchy, this is soft, this is a spread. Because spreads can be also a great way to help. Um, for example, if you find like there are some sweet sesame spreads, I don't have them on my shop yet, but something that I found can be sweet, for example, for a child that likes sweet, but gives them some protein and can be a good transition to liking something else. So that's the category I put. And then I was like, okay, sometimes we need supplements because as these children are learning to like new foods, there are tricks for macronutrient deficiencies. I'm not just gonna let them take years to learn to expand their food repertoire and risk deficiencies. Yes, I want to take the years to help them learn, but at the same time, I want to minimize deficiency risks. So I start to look for supplements because for children, not all vitamins are the same. I guess for adults too, but for children, I found more variability. So, for example, you have to look specifically for the ones that have iron or the ones that have zinc, for example. So I started to look for vitamins that have iron and put them in there. So when you go to my website, www.feedingsolutions.ca, you will see a lot of products are for children, even though there are other ones that are not for children, because the main thought came from working with children, and then I started to add more and more products. And then one of the things I also do when I work with children is that I would do a food journal analysis to see which vitamins are missing. Yes, I can eyeball it based on the food group, but when you do an analysis, it gives you a deeper understanding. Like there might be specific nutrients that's lower or higher. And then sometimes you would want to target this specific nutrient. For example, calcium is low, but they hate dairy and alternatives. I would rather give them calcium supplement than let them like while they're learning to like the foods that have calcium, then just wait and give a chance for their bones to be weak. So you will also see under my supplements in the website that there is like, for example, calcium, iron, omega-3s, multivitamins. I'm still working on doing the filters for those so that it's more dietitian friendly. If you're looking for a specific vitamin, you can like check it out. So that's coming. And other things that we don't usually do in dietetics, like we don't learn it in dietetics, but I just learned it from working with the healthcare professionals like occupational therapists. They use what is called like oral motor therapy tools, for example, like something that's called chewy tube. So to learn to like in a bite and pull, like to work on these muscles to get them stronger, or like for sensory. So I did also include a list of products there. So it's like to put all the feeding needs in one place, basically. And of course, being a dietitian, enteral nutrition formulas are important, so I included those. Supplements, because we do know the basic ones, but there are so many more ones that we don't turn to learn about much, because for some companies we get reps come to the centers and explain about the products. For others, you don't see necessarily much information unless you look for it. So I also tried to look more and add more products. For example, for vegans, there are products I learned about as I was doing my search. And also for dysphagia, we use thickened products, thickeners. So I included those as well because many people have difficulty finding these. And I do work with special needs, so I see, like I encounter this population more than at another center, for example.
That's a great job. I think there was a gap before you. There was a gap. You filled the gap. Okay, interesting.
Thank
And
you.
is it just an online
At this point, it's only an online store.
shop?
Yes, yeah. I'm still improving it. Like it's functional and everything. It's still not perfect yet.
It will be soon.
Yeah, working on it. Working on it.
Very, very interesting. Thank you so much. And then The last question. No, it's not the last one. Actually, I have two questions. Is it okay if I
Of
ask?
course, yeah.
Okay. So the first one is that how did you deviate towards the children nutrition? Like, how did it happen?
So this started from having children for me. Being somebody who came from overseas, I had some delay in entering university. Like I did so many courses before university. Um, so I was an older student, right? So I ended up having my first child after my second year of university, and then my second child after my first year of master's. And being in that situation where I'm learning and I have a child, I was always interested in learning about children. It was, yeah, it was wonderful. But I didn't have much experience before having children. Um, so I didn't realize it that much. Like I remember when they asked me if I wanted to choose an optional rotation for my internship, and I said maybe pediatrics.
Oh.
Like I knew I was interested, but I wasn't sure I was only interested because of my children or if I wanted to work on it. And it ended up being at the hospital, which was very easy for me because it was with babies and I already had my babies and I knew. So they told me if you end up if you want to work in pediatrics, it's the right place for you. But at the time, I don't know. It just sometimes things just happen at a certain way. Like it ended up, like from where I ended internship, did food service, came here, started food service because it was just the logical progress. But then my first work at the clinic was actually pediatric here in Quebec. It was pediatric. Um, I think I had realized my interest because even when they did the interview with me, I was already enrolled in a pediatric online course. So I knew I was looking for online continuing education courses in addition to French, but in nutrition. And then one of the available offers were pediatrics, so I took it. And then it happened that I had the interview for a pediatric position, so I did it, and then I enjoyed it. And then I did geriatrics. It was actually also interesting, I have to say. I also enjoyed it, but I found it a bit sad. But then an opening for pediatric came up, and I was like, oh my God, like, this is what I want. And I have to say, I think it's the best place I've ever been. Like, I enjoy
Oh, wow.
it. Yeah. But it's just funny how I didn't realize it before having children. It was just something that I learned later, I think. Some people are scared of pediatrics because they feel like they don't have that experience with children. I realized this because when I did my rotation, they told me I was more comfortable than other people because children are growing, so their needs are changing. Like
Exactly.
toddlers are different from infants, different from like younger children, older children, teens. Uh, it's more dynamic, but for me, I like the challenge. I like that they're all different. Like their nutritional needs are different. When they're younger, you're working with parents. When they're older, you're working with them and their parents. It's like it is very, very interesting and more stimulating, I found.
Yes, it's interesting. You know why I asked? Because I had another live session with Khalifa, and she had the same journey. She became a mom, and then she moved. She moved towards children and then children's nutrition. But being in community nutrition, and doing my masters, I think like the whole world is turning into more maternal children nutrition health. Everything is changing towards them. I don't know how. Maybe It's just my
You,
thoughts.
you set up the steps for success. Like when you're starting with strong bones, for example, as a kid, you have a higher chance of having strong
Exactly.
bones at the. So many things, yeah, start early. There is even a program here for 0 to 5 years old, like the government pay for more like services because like when you start right, you have a better chance of having a good health later. And like breastfeeding, for example, also like all the big advantages of breastfeeding versus like formula, for example, when possible. um, so it's like yeah, we keep learning more and more about benefits for infantile nutrition. My master's actually was my thesis was intake of omega-3, specifically like DHA, and also I looked at omega-6, specifically AA, during pregnancy and the effect on
Mhm.
children, like earlier in life, like 3 months of age.
Yeah, that's a good point. Yeah, that could be why they're shifting towards them. Yeah, interesting. And then being in Canada, I got introduced to holistic nutrition, and I wanted to know if you have any thought like on.
Yeah, I'm gonna tell you a little personal thing first because it will show where my perspective is from. Before I started university in nutrition, I wanted to explore what I like.
Mhm.
So I did so many things. Like I did some medical training with a doctor just out of interest, but that was overseas. Here it would be so hard. So covered like some basics of physical exams, etc. So I was exposed to Western medicine. At the same time, came here. I did the professional reflexology course. I did iridology. I did Reiki. I did, oh my God, I did so many at the time that
Wow.
sometimes I don't even remember because it was many. So when I was doing all these alternative medicine courses, I was in contact with people who did not believe in Western medicine. Not all of them, but many of them didn't believe in Western medicine because they felt like they didn't get the answers they
Exactly.
wanted, which is sometimes true. Sometimes we're not getting the answers we want. Like we don't know causes for many cancers, right? Now, some of these practices are without risks in general. Like you go do reflexologies, like you do massage, sure, why not? But the risks become when you skip an important treatment for a practice that you're not sure it's gonna work.
Mm.
You can lose a chance of healing, right? And these are the safe practices, but there are other practices, for example, like let's say working with herbs. Herbs are amazing, but some of them are studied, some of them are not studied. Personally, if I'm taking an herb now, not before being a dietitian, I want to make sure if I'm taking it in high doses, like a supplement, that it was proven for what I'm taking it for and that it's safe. So there's like, in Canada, it's NPN or DIN number. So it's safe for use. But you asked me how I did it before studying nutrition. No, I was taking random herbs because the thought at the time was that if it's traditional, if it was used for years, then it's safe. But we're not taking it the way it was used years ago. Like we're taking a high risk, and some people get sick from it. Some people have like liver failures because of a supplement that was not
Unfortunately, yeah.
proven. It's toxic. Now back to your question about holistic nutrition. I do believe in looking at everything, right? Like we wanna we wanna look at the body as a whole. As a dietitian, it's not like what they say that dietitians are just looking at specific things. Then we're failing at our job. We have to look at everybody as an individual. We have to look at everything. What you eat, your how much you exercise, your blood tests, your like we ask always about bowel
Mm.
movements. We ask about any symptoms you have. We ask about any medical conditions, any medications you take. We ask what's practical for you, what's not practical. We're not just going to give you a random recommendation. We do look at everything as a whole. And we do have 4 years of nutritional education plus an internship, right? Now, look at holistic nutrition. What do they have? They're all over the place. There is no specific requirement. So you might go to a person that did only like a couple courses. I don't know what the requirements is, but when I looked, there were nothing close to what a dietitian's requirements are. So they're saying that they're looking at the body as a whole and that dietitians aren't. But then, okay, when you look at their education, how much do they know? Do they really know more than us? Do they really study all the possible issues from like everything they're recommending, or not? Are they regulated like dietitians? Why are we part of a college? Because the college has to protect the public. We have to do continuing education. They don't. So basically, you are like a holistic nutritionist is somebody that can be very experienced or very, very unexperienced. It's up to chance how many courses did they take. I would definitely prefer a dietitian. And here, look at me. I started alternative medicine, and I chose the university way, knowing even like being it within the alternative medicine community. I do like it. I do respect it. I just think that looking for what's evidence based is very, very important. And if you're doing something that's not evidence based, it has to be safe. If it just makes you feel good, it's not proved. Sure, just make sure it's safe though. Yeah,
Makes sense.
that's my
That makes sense.
that's my
Thank you for sharing your thoughts.